Mute your microphone when speaking only. Thank you so much. Dr. N. Kalai Selvi, Director General CSIR, members of the organizing committee, Dr. K.J. Sriram, Professor Ranjana Agarwal, Dr. Srinivasa Reddy, Dr. N. Anandavalli, Dr. Vinay Nandikuri, Dr. Bhaskar Narayan, Dr. Ananta Ramakrishnan, distinguished speakers, dignitaries and participants from India and from across the world. After the huge success of the CSIR scientific sessions in the Science Summit at UNGA 77 and UNGA 78, CSIR is back with the third edition. I welcome you all to our science session named CSIR for Connect, Collaborate, Converge, and Convert 5C for Global Sustainable Development. CSIR has been contributing significantly to the industrial, societal, and economic growth of India for over 8 decades now. CSIR's research and innovation activities are well aligned with the UN SDGs. This session, CSIR for Connect, Collaborate, Converge, and Convert for Global Sustainable Development, will briefly showcase our S&T interventions and solutions contributing to the UN. Let's also discuss ways to strengthen South-South cooperation. The two-day event would encompass 5 scientific sessions and a panel discussion focused on strengthening South-South cooperation for sustainable development. Day 1, which is today, will start with a brief overview of CSIR by Dr. N. Kalai Selvi, Director General of CSIR, who is also the Secretary to the Government of India, Department of Scientific and Industrial Research. This will be followed by 4 scientific sessions presenting a few technologies for sustainable development. 13 presentations will be made by the subject experts in these topics on affordable healthcare for sustainable society, food and agriculture, environment and waste management, sustainable infrastructure. The sessions will be moderated by eminent experts as the chair. There will be about 6 minutes discussion and Q&A break after every topical session. Participants may type their questions in the chat box or can raise their hands during the Q&A time. Day 2 event is scheduled for tomorrow, the 19th of September at 2:30 p.m. IST, just like today. The event will primarily focus on strengthening the South-South cooperation. It will begin with a scientific session on climate change that would feature 2 talks. This will be followed by a special joint session of the World Association of Industrial and Technological Research Organization, the WETRO, UN's Asian and Pacific Center for Transfer of Technology, APCTT, and the CSIR India. Experts. The meeting will conclude with a panel development. Also, CSIR has set up a virtual booth at the UNGA 79 platform. It features 50 videos, an almost equal number of posters showcasing technology strengths of CSIR. We invite you to kindly visit our booth. In effect, this event aims to acquaint the global S&T fraternity with some technological strengths of CSIR, its technology-based solutions and their applications to societal welfare, as also to foster global collaborations. We are certain that this informative and interactive session will be immensely useful for the global scientific community, startups, industry, policymakers, global think tanks, and other stakeholders working towards global sustainable development. The deliberations would ignite the development of a new partnership platform, new collaboration models, engagement in policy dialogue, strengthening overall global connections with a particular focus on South-South cooperation. With this brief context, I now request DG Ma'am to kindly welcome you all and give a brief overview on CS.
Thank you, Dr. Rama. Namaskar and Vanakkam. I'm extremely happy to be a part of this 79th edition of SSUNGA. I'm so glad that this is the 3rd time that CSIR is participating with a kind of a definite focus this time, rather than the last 2 times, like 77 and 78. Because the learning curve of CSIR got strengthened during this SSUNGA 77 and 78, because we realized based on your inputs, your discussions, your suggestions, and your advice, we were given to understand that the South-South cooperation needs to be strengthened. Whenever we just want to achieve any kind of a target, so in this case, it is sustainable development goals. Now we know that it is very much essential that the sustainable development goals are to be given priority, implemented, and they have to be complied with across the globe without having any kind of a second thought. And therefore, now the integrity and compliance as a team is required. And therefore, we feel that from all possible directions, the support should be showcased and demonstrated in real-time application. So it is at that point of time when we started discussing what are the points of strengths and what are our points of weakness, we realized that this is very much needed, especially at this point of time. The South-South cooperation needs to be strengthened towards this particular direction. And many times, even in other cases, just last week also, when I happened to listen to another very important talk, I was told that many times the data from the northern side is getting presented and represented well. And just because the data is now getting presented and admitted and accepted for brainstorming, decisions are also to be taken based on the data being presented. So therefore, who is at fault? So why this South-South based data is not getting presented, or South-South linkage or the collaboration or the team or the synergy is not getting represented, needs to be discussed. If at all we want our problems in real-time application needs to be solved, I think the real-time data should be first of all presented. And this is where I think strengthening the South-South cooperation assumes importance. And especially last year, we from CSIR, we volunteered and we took the responsibility to lead this particular role of strengthening South-South cooperation, especially to energize and synergize all of us towards these sustainable development goals for their application across the globe. I should really appreciate and congratulate the entire team of CSIR with a special relevance to my ESTAT team, which is headed by Dr. Ramaswamy Bansal and her entire team, and the galaxy of directors who are devoting your very, very precious time today and tomorrow, along with your scientists, because you are now going to share very important points which will be taken into consideration for making policy level recommendations. Because for any kind of implementation, we definitely require some kind of a recommendation. What is it that we have to do? Some kind of basic understanding is needed. So in this case, policy level recommendation is felt to be required. And that's why this particular team has already taken some kind of a prelude conclave on 11th September. Again, my appreciations are due to Team CSIR. You have spent quite a good amount of time, quality time, in listening, in also talking, brainstorming. And I'm sure today evening, Dr. Ranjana Agarwal, the director of NISPER, will be coming up with the consolidated presentation of whatever has been already discussed on September 11th. And I should again appreciate and congratulate Team CSIR, because the title is very, very catchy. 5C they're talking about. Normally, C means in chemistry, all of us, C means we will say it is only for carbon. Now, carbon is slowly becoming an arguably interesting symbol. So whether carbon is good or bad, so when carbon is present inside, it is good. When carbon is present in the atmosphere, it is not so good. And therefore, it is only C6. And therefore, carefully, the team has restricted themselves with 5C. So first we need good connect among ourselves, especially South-South linkage. Then we need to collaborate, because many times we talk, then we forget. So once the meeting is over, most of the times the tempo or the spirit is not getting maintained. And therefore, unless otherwise we collaborate in real time, the same tempo cannot be maintained in the coming days. Therefore, collaborate is very much essential. When we collaborate, definitely different viewpoints will also come into picture. Therefore, at one point of time, you have to converge at one particular point. So for that is what I normally call synergy, because we have to synergize our efforts and we have to converge. And after you converge the whole thing, you have to convert it into action. So if at all we do everything in the name of policy or recommendation or minutes of the meeting, I think things will not be solved actually at the final end. And therefore, the last point or the last mile connectivity is it has to be converted into action. Therefore, to just take care of all the four C's, to connect, to collaborate, and to converge and to convert into action, now CSIR is taking the lead. And I think this is the right time. All of us should talk very transparently, and we should own the responsibility. Let us commit our accountability very openly. How best this could be converted into actionable items, and who is going to implement all these points. So all these details may be discussed in today and tomorrow's discussion. Unless otherwise we just note down and we make it as a document that who will do what and when will we do, how will we do, and till what time we will keep this doing. All these points, if at all we are able to elaborately document it, I think this document will become the roadmap by means of which this South-South linkage will automatically get strengthened. I think in the coming years, we should have the opportunity of proudly lifting our collar up and say that, yes, we have discussed in 2024 all these points. Now at least 1/3 is done, 1/4 is done, or half is done, 80% is done. This is how I think in the coming years, we should be able to come up with the tick marks on the ATR. So I think today's meeting and tomorrow's meeting are very, very important, crucial. And in my opinion, these 2 days are going to decide the future activities as far as SSUNJ related activities are concerned. And one more time, I take the pleasant privilege of welcoming all of you, because I join with Dr. Rama, because this is a call from CSIR, and all of you across the globe, different nations, you have already given your consent and you are representing your nation. And we are extremely happy to see such a kind of a great response that is being received for a call that is going from CSIR. So CSIR feels very proud, and we take this as a great honor. We consider this as an opportunity, and we wish to make use of this opportunity in the favor of the sustainable activities, which will be definitely benefiting the nation as well as the globe. So with these few words, experts are waiting to share your opinion. And I just make it one more time, my appeal to my STAT team. So you are doing a great job. Please give it a great strong shape so that from next year onwards, you should allow me to put a tick mark that, ma'am, we decided this and we are here. So thank you so very much for each and every one of you for your effective participation. And I should thoroughly appreciate one more time the quality time which is being invested in this particular exercise by the entire CSIR community. And special thanks are due to all the directors of CSIR laboratories. And 1 or 2 directors are even physically present here. That shows to what extent they are truly interested in this particular exercise. So with these few words, I look forward to listen to your recommendations. And you should excuse me because I may not be able to enjoy and take part in the complete proceedings. But in the name of Kalaiselvi, the entire team is here. So I think you will do more than enough justice in the name of Kalaiselvi. Thank you so very much for the opportunity, and wishing the event all the very best, and wishing the event great success. Thank you so very much.
Thank you so much, ma'am, for setting the context of the meeting, for defining its relevance as also the aspirations. And thank you so much for your encouraging words. Now it's time for us to move forward with our technical session. So the first topical interaction we will have is on affordable healthcare for global society. And the session will be chaired by Dr. Vinay Kumar Nandikuri, who is director of our Center for Cellular and Molecular Biology. Dr. Vinay is a PhD in molecular and cellular biology from Indian Institute of Science, Bangalore. He was a postdoc at Texas A&M University and at University of Virginia. He has research interest in delineating the kinase-mediated signaling networking in MTB. He has 80 research papers in international journals of high repute. He has been conferred with several prestigious awards and honors, including the prestigious J.C. Bose Fellowship. With this, I hand over the stage to Dr. Vinay.
Thank you, Rama. Today, the topic that we are going to discuss in the context of healthcare is affordable healthcare for global society. CSIR actually has 37 labs, of which almost 15 labs extensively work on various biological problems, which are like CCMB, IGIB, MTech, ISCB, IIIM, CDRI, NCL, and ISCT. I have kind of outlined what do they work on, what their focuses are, but basically what we look at and work on is that we invent and deploy latest bioinnovations, tapping into modern technology and traditional knowledge to make healthcare affordable and accessible, ensuring physical and mental wellness. We work on almost every aspect: precision health cohorts, drug discovery, phytopharmaceuticals, new biology, healthcare devices, diagnostics, and digital health. We have CSR contributes in various aspects, including drug discovery, drug development, and manufacturing. So this is basically the outline. I basically wanted to take this introduction to talk about some of the major projects that are currently going on in the healthcare. One of them is sequencing 1,000 Indian breast cancer genomes and looking at RNA sequencing analysis for these triple negative breast cancers. It's almost 1/3 or 2/3 of this project is almost done. Remaining 1/3 is going to go on. And once this happens, the data analysis and other things would happen in this particular project. And the other one, which CSIR has taken as a huge project, is something called Phenom India, where we are looking at 10,000 CSIR employees, and they're looking at all the health parameters. And this is done pan-India, across India, in all the 37 labs. And there are some fantastic, interesting data that is coming out. And in future, I'm sure there will be something that we can come up with some interesting conclusions out of this, analyzing the data from the 10,000 patients, including 6,000 microbiomes. And we have also worked on, and it's a national or international problem too, which is sickle cell anemia. 7% of Indian population is kind of either heterozygous for it. We are working on population-based test. We came up with a new blood-based test for it. We're looking into screening newborns and prenatal diagnostics. This is something that we are doing with many other organizations. That's the brief outline that I wanted to give about the healthcare before I introduce today's speakers. Our first speaker is going to talk about generic drugs. This is Dr. Srinivas Reddy. He is the director of CSIR ISCT Hyderabad. He's a trained organic chemist, PhD from University of Hyderabad and Institute of Sciences. Gained experience in medicinal chemistry and drug discovery from pharma industry. He is known for his application-oriented organic synthesis for human well-being. He's got lots of, he's synthesized lots of natural products, 35 patents, and more than 145 publications. He is highly recognized for his work, which includes Shantaswara Bhatnagar Prize. That he would talk about generic drugs actually in a while. Our second speaker who's going to talk about in the affordable healthcare for global society is Dr. Radha Rajan. She is the director of CSIR CDRI Lucknow. She is involved in translation research and product development with the AMR as the focus. Worked in drug discovery divisions of Reddy's initially. She's founded Vitas Pharma, dedicated to the discovery and development of antibiotics. She took over as a chief technology officer in HealthCube in 2020 and took over as a CDRI director in 2022. So with this, I would ask Dr. Srinivas to share his thoughts. Thank you.
Thank you. Dr. Vinay, can you hear me?
I can hear you. Yeah, I can see the slides too. You can proceed.
Okay. Thank you very much for your kind introduction. So since it is the first presentation, I thought I'd just give you one or two slides about CSIR. CSIR is one of the largest organization in our country. We have 37 labs across the country, starting from northern most part of India, that is Jammu Kashmir to Kerala. So we have different sectors we work. Like each color code depicts different part of science. And we always have our elected Prime Minister is our president, and Vice President is our Science and Technology Minister. So just now you heard from Dr. N. Kalai Selvi. She's our Director General of CSIR. She heads all the labs, all labs across the country report to her. And we have 8 teams in CSIR currently. So starting from aerospace, electronics, instrumentation, strategic sector, and we have ecology, environment, earth, ocean science, water, mining, minerals, metals, materials, healthcare, and agri-nutrition, biotechnology, civil infrastructure, and we have energy and energy devices, and also we have chemicals, which includes leather and also petrochemicals. So the current, next couple of presentations are comes under healthcare. So just to tell you, India provide generic medicines to more than 200 countries to the world. India supplies almost 20% of the medicines consumed by the world. Every third, according to one report, every third tablet in the US market is coming from India. Out of that, Hyderabad playing a major role, where IICT is located presently. So as of recent data in 2024, India has about 370 FDA registered pharmaceutical facilities. At the same time, we have 140 European and GMP complied units are there. And also 60% of the World Health Organization, that is WHO, pre-qualified APIs are sourced from India. Not only generic medicines, even vaccine requirements are almost like a 2/3 of vaccine requirements are sourced from India. So if you put in a nutshell, so India is predominantly a generic player. And how it became? Because CSIR played a major role in making our India as a pharmaceutical hub. Was before 1970, there was almost non-existent. There was nothing coming from India. Because in 1970s, 90s, introduction of this revised patent act in 1970, that's where started our boom. So domestic companies are well equipped with, of course, with the help of our CSIR collaborations. So they became strong and they started producing generic drugs. And later in 1919, 2010, so it expanded, and the CSIR technical skills also improved, and also more collaborations and more productions from industry as well. In 2010 to 2020, so import substitution we started looking at, and there are many import substitutions also we replaced, and we also came up with the many cost-effective processes and transferred to industries. Of course, CSIR played a major role. In addition to that, IDPL, there are other few organizations in the country also helped in making India as a pharmaceutical hub. And of course, in the future from 2020 onwards, more focusing on sustainable chemistry and also biopharmaceuticals. So among CSIR labs, I can name at least 4 labs played a major role. CSIR IICT and National Chemical Laboratory and the Indian Institute of Integrative Medicine from Jammu and the CDRI. And also there's IMTech, particularly in biopharmaceuticals. Just to tell you, audience who are not much familiar with this generic drug, there's all difference between branded comes from innovator, and it's a long process. It's almost it takes about 12 to 15 years to put a branded drug into the market, because you have to drug discovery starts, then IND submission, clinical studies, and safe effectiveness and human clinical studies. All this put together, it takes about 12 to 15 years. At the same time, generic medicine is nothing but is identical bioequivalent of an innovator. That's a branded drug. So in dosage form, safety, strength, and route of administration, of course, in the quality and performance. So this takes about 2 to 3 years to make to put in generic drug in the market. So that's where many Indian companies played a major role in making generic drugs in different companies, different parts of the country. Of course, ultimately, our goal is to manage public health or giving access. Like most of the places, they may not be able to afford drugs which are coming from branded. So that's where when drug becomes generic, when patent is like expired, that's where more generic comes into place. And that's where most of the companies in India play a major role in making affordable health to all the public. And this slide is partly already covered by our Vinay, Director of CCMB. So this is basically we have our CSIR equipped with starting from drug discovery to drug development, manufacturing, distribution, sales and marketing. Basically every part of drug development, we are, name it any part of drug discovery and drug development, manufacturing, we are there. And just to give you a couple of contributions what CSIR labs have made. So one of the drug few decades ago, this is called AZT, that's an AIDS drug. So that's called zidovudine. This contribution came from IICT, where I'm presently talking, and developed process transfer technology to Cipla. So this helped in producing large amount of this AZT drug and supplied to the whole world. And that used to be very costly drug. That became, because of our effort and Cipla effort, it became $1. Otherwise, it used to be almost like 10 times more than that drug, that cost. So that's where we helped the whole world by producing AZT drug. Similarly, CSIR Imtech, streptokinase clotbuster drug. This again technology package to produce high standard natural streptokinase. Again, this transferred to Cadila Pharmaceuticals in the year 2001. Again, that made available to the public. And similarly, NCL, the National Chemical Laboratory contribution, is an amlodipine bacillate, a long-acting calcium channel blocker. Of course, they used a chiral resolution using L-tartaric acid, and again transferred to MCure Pharmaceuticals and scale up and commercialization took place, and finally went to the commercialization to the market. Similarly, a couple of other drugs like misoprostol. This is developed in collaboration between IICT and Aura Laboratories. This is useful for reducing death rates during abortion. Similarly, nevirapine, that is CSIR NCL, developed a process towards the chiral synthesis of this nevirapine. Again, it's also transferred to Cipla and they produced to market. And similarly, CDRI, that is Central Drug Research Institute, contributed a lot in L-ephedrine and transferred to Maladi Drugs Pharmaceuticals. And this is in 1981, several thousands of tons produced using the technology developed at CDRI. And this also became very popular in those days. And very recent contribution to Indian generic industry is, I'm sure you all are aware about acetaminophen, that is a paracetamol. And so if you look at the market, it's expected to reach $1,500 millions of US dollars by 2028. That's the projections what we have currently. And NCL NCL, National Chemical Laboratory Pune, have developed continuous cost-effective of eco-friendly production of paracetamol. This para call it. And there are two techniques they used. There is a reactive distillation the reactive distillation method they used, and where you can use acylating agent can be recyclable. So that's where, and also organic solvent purification also they did. So that's again transferred to the industry, and now they are setting up a big plant near to Hyderabad. And other one is a highly efficient and scalable process for manufacturing of azelaic acid from oleic acid. It's a continuous flow process, 100% conversion of oleic acid, and it takes only 2 minutes to oxidize. and separation also, we came up with excellent separation technique. And finally, a pilot plant established at NCL, Pune, and finally transferred to other industries. And very recent contribution coming from IICT is during COVID time, we are all struggling for medicines, particularly early stages of COVID pandemic. There was no drug available. At IICT, we have developed a process, Favipiravir. That's one of the early drugs for mitigating COVID. So we developed a process and connected with CIPLA. Together, we marketed the drug. So that's, we look at the dates here, on 20th June 2020, that's very early stages of our pandemic, we launched this drug. And similarly, I'm sure everybody aware of this co-vaccine that is developed by Bharat Biotech. Every vaccine has different components, different ingredients. One of the ingredient called adjuvant TL-toll-like receptor 7/8 agonist molecule, that is an imidazoquinolone molecule. That is, there was no process was available in India. So we developed at IICT and we supplied kilograms of material to Bharat Biotech. They combined with and they produced this co-vaccine. So basically, if we were to co-vaccine, there's a small component of CSIR component present there, English micrograms of amount is present. So there's some of the contributions what we made in terms of generic drugs. So we have, if you look at just drugs, recent drugs, we are trying to analyze small molecules out of 224. There's a fluorine containing compounds are about 65, peptides about 15, nucleic acid, and biologics about 106. So where we would like to focus in that direction. So again, particularly, we would like to focus on key intermediates from renewable sources and sustainable technologies and platforms. That's what we're trying to focus in the future. And like key starting material peptide coupling reagents, like catalyst, new reagents. There are new techniques, new platform technologies like flow technology, what I discussed in the previous slide about azelaic acid production, and automated synthesis, electrochemistry, photochemical chemistry, mechanical chemistry. These are the new platform technologies coming up. So we'll be focusing on some of those areas. And just to give a snapshot of molecules picked up by our government of India, that is a PLI, production linked incentives. This is to promote domestic manufacturing, particularly to import substitution. There are key starting materials and drugs intermediates for APIs. We have picked, the government of India selected 53 bulk APIs. 27 of them are synthetic and 26 of them are fermentation or semi-synthetic derivatives. So these are the molecules we picked up. Some of our laboratories are working. We are running mission projects towards some of these molecules. And here is just I want to show you this slide that CSIR labs are well equipped, starting from drug discovery, drug development, and also process development at kilo levels. And finally, we have diverse technology portfolio, and what I was trying to tell you is CSIR could be the ideal technology partner for interested global scientific community, industry, startups, policymakers, and financial institutions, investors, and other stakeholders for working towards global sustainable development. And thank you very much. And if you have any questions or suggestions, please write to Dr. Rama Bansal. She is our chief scientist heading our STAT, that is Science and Technology Affairs, International Affairs. Thank you.
Thank you, Dr. Srinivas. Are there any questions?
I think questions will be taking later, I think, right?
Yeah. So we will ask Dr. Radha to talk about AMR and her thoughts on the AMR part of it. Radha, go ahead.
Good afternoon, everyone who is in the Indian Standard Time Zone, and good day wherever you are. I'm going to put my presentation in slideshow mode. I hope you can see it. My presentation is going to focus on tackling a very, very important healthcare problem, antimicrobial resistance. This is a problem that perhaps some of you are familiar with in the context of antibiotics. Antibiotics that worked perhaps 10 years ago don't work now. The reason for that is that the bacterial pathogens have become resistant to antibiotics that have been used significantly. In a 2019 study by the Lancet, the data showed that there are 1.2 million deaths due to bacterial resistant infections. And there were 4.95 million deaths associated with resistant bacterial infections in 2019. And the 5 leading pathogens associated with mortality are E. coli, Staphylococcus aureus, Streptococcus pneumoniae, Klebsiella, and Pseudomonas. These pathogens are responsible for a very high level of morbidity and mortality, and that burden is most acutely felt in LMIC's low and middle income countries. The reason that antimicrobial resistance is such a major problem is that it tends to spread easily. Not only not only are there biological mechanisms by which transmission happens, but also other factors such as trade and travel also help move these highly resistant pathogens around and therefore cause disease globally. In 2014, in a report produced by Lord Jim O'Neill on the AMR problem, the committee that he headed and which reported to the UK government estimated that if the AMR problem is left unaddressed, then by 2050, one anticipates 10 million deaths. And these numbers have been substantiated more recently in a Lancet publication that estimated about 8.8 million deaths by 2050 based on current trends. So these are really heavy numbers. The burden is unacceptable, and we need to focus up our minds and efforts on solving a problem like this because it forms the bedrock of modern medicine. In the absence of antibiotics, probably we can't lead the same lives ever again, and therefore there is a very critical need. If you look at the global antibacterial pipeline, unfortunately, there is a sad story in that in October, in the 2021 data published, there is a very limited number of antibiotics in all 3 phases of clinical development. 64 new chemical entities. And when you look at the pathogens that they are addressing, many of the pathogens of critical interest are not part of this list, which means that the number of antibiotics coming into the market and the kind of AMR that we see are not matched. There will be a deficit, and this will lead to additional deaths that could be prevented if we had the right drugs. At CSIR, we have a multi-pronged approach to AMR. Many labs have research going on. Today, I will present vignettes of research from select labs, and I'll name them as we go. Some of the labs whose work we could not talk about due to time constraints, such as Intec, Ampri, and Secre. I will mention that they also work on drug discovery. They work on surveillance and diagnostics. But the bottom line is that the efforts within CSIR are focused on critical and high priority pathogens such as Enterobacteriaceae, which includes Klebsiella and E. coli, Acinetobacter pseudomonas, Staphylococcus aureus, Enterococcus, and now Salmonella, which is emerging as a major pathogen that is resistant to typical drugs such as azithromycin. So CSIR's activities can be depicted as being in surveillance, disease biology, understanding how drugs and lead compounds actually exert their antibacterial action, identification of novel drug targets, discovery of novel antibiotics, identifying new routes of administration for existing antibiotics, and then diagnostics. And all of the labs that work in the AMR field are mentioned here. I'll now present you snapshots of some of the work that goes on in CSIR labs. This is work from the institute where I'm director, the Central Drug Research Institute. This work is about a compound that was identified as being specific to Acinetobacter baumannii. This is a very, very significant pathogen associated with ventilator-associated pneumonias, hospital-acquired pneumonias. And there are very few drugs that are able to treat such infections. The compound that was identified was in collaboration with CSIR Pune, another academic research institute in India. And this particular series, the heterocyclic diaryl iranium compounds, were tested, and a compound PKV70 was identified as being highly effective. And it is equally active against multi-drug resistant Acinetobacter. It has shown a bactericidal activity against carbapenem-resistant Acinetobacter. These are Acinetobacter that are resistant to last-line antibiotics with no major detectable resistance despite continuous exposure to the compound. It synergizes with amikacin, and it also performs better than polymyxin B in an in vivo efficacy model in the Thai model using Acinetobacter. And finally, using a chemoproteomics approach, the mechanism of action was deciphered, and this has identified a new target, a betaine aldehyde dehydrogenase BET, which is now positioned as a novel target that upon which more drug discovery can happen. The reason why this is of interest is because in the antibiotics field, not only is it that there are a limited number of compounds making their way through clinical development, but also the number of validated targets is fairly limited, which then proves to be a problem for identifying new compounds. Another way in which CDRI is contributing to identifying new drugs is by taking a repurposing approach. In this approach, we look at the activity of existing approved compounds. In this case, we have studied disulfiram, which is used to treat chronic alcoholism, and ivacaftor, which is used to treat cystic fibrosis. Both these are active against gram-positive bacteria. Disulfiram is also broadly gram-positive active, Staphylococcus and Enterococcus, no cross-resistance to other antibiotics, and has shown a mostly bacteriostatic mechanism of action. The interesting thing is that it is equally active against vancomycin-resistant Staph aureus, and in vivo activity is comparable to vancomycin. Ivacaftor similarly is static and has again shown activity comparable to vancomycin in a murine Thai model. So these drugs, because they're already approved, need to go through very, very limited clinical trials in order to be used as drugs in the clinic. And as I showed you, the burden from Staphylococcus aureus continues to be high and will remain so in the foreseeable future. Work done from IIIM Jammu, interesting work that is focused on Pseudomonas. Here, initially a library of 3,500 compounds was screened. This is a ChemDiv library, so available, commercially available. And out of this, a particular scaffold, a quinazoline scaffold, was identified as having activity against Pseudomonas, and then modified, optimized to obtain this compound IIIM 8E, which was then extensively studied not only for MIC, but also for biofilm disruption, swarming and motility, and synergy with other antibiotics. This compound is now positioned for further SAR and for deciphering the mechanism of action, as well as determining whether this potential target, WAAP, could be the mechanism through which this compound is exerting its action. Again, novel target, novel compound. In work done in IICB Kolkata, a strategy that is being tried is to take known antimicrobial scaffolds, create hybrids, and thereby generate novel compounds that would then be able to overcome existing resistance. So in work done previously, 6 nitropenoxyline derivatives were shown to have effects on the DNA structure, leading to bacterial cell death. Now, this scaffold is being combined with a quinolone scaffold in order to generate new antibiotics. And the thinking here is that these antibiotics would then be able to would then be potent and also able to overcome existing resistance. And this is still work in progress. We can see that these compounds are active against Staph aureus and E. coli, and with further optimization and demonstration that they are active against fluoroquinolone resistant isolates, these are potential leads to take forward. The next set of slides are this particular slide. It comes from IGIB Delhi. And here the focus has shifted from synthetic compounds to compounds that could be that could be mined from bacteria. And this is, of course, the classical way in which antibiotics were originally discovered. And here, the approach that was taken was to screen a library of bacterial isolates against resistant bacteria, in this case, colistin-resistant E. coli and carbapenem-resistant E. coli. And the isolates that were identified as generating metabolites that were able to kill these bacteria are shown here, B5 and B15C. A number of biosynthetic gene clusters have been identified in both these species, in both these strains, and further bioassay-guided isolation of molecules associated with these bacterial strains is being undertaken to first purify the molecule that is leading to this activity, and then and this will be followed by structure elucidation. And then on the drug side, another interesting piece of work I want to highlight is from IICB Kolkata, where dissolving microneedle patches are being developed which contain both an antimicrobial peptide as well as a beta-lactam antibody, and these microneedles can deliver high concentrations of antibacterial drugs locally. And thus have great application in skin infections, as demonstrated here. In these are self-dissolving and hence easy to use and require no specific technical expertise. And the data here shows that upon administration of this combination, there is reduction of bacterial burden, both Staph aureus and MRSA, which is demonstrated in the graph. So, shifting gears a little bit now, moving away from drugs to a more holistic understanding of what is going on and why antimicrobial resistance is spreading so much. I want to take you through the work that is happening on the surveillance side in the CSIR fraternity. So, the issue at hand is that there is limited data on population level AMR prevalence, including seasonal and temporal variations, variations by geography, community versus healthcare sites, and so on. So it is hampering our ability to make accurate risk assessments for AMR transmission, and therefore perhaps it is in the way of trying to figure out how to prevent highly resistant infections. So two types of surveillance methodologies are being utilized. One is the slide which is up here, and this is related to surveillance in the home. So in this particular study, which was undertaken in urban houses in New Delhi, samples were collected from 9 physical locations in 10 houses, and the microbiota included 1,000 bacterial, 18 fungal, and 474 viral species. A substantial fraction of the bacterial species were potentially pathogenic or opportunistic pathogens, and escape pathogens and emerging pathogens such as Clostridium perfringens, Staph aureus, and Rickettsia pallis were detected. In fact, E. coli was more abundant, and interestingly, it was more abundant in the bedroom, foyer, and drawing room locations in the house. This kind of data can really help with devising strategies for how to prevent and how to move and how to stop transmission of pathogenic bacteria. The work that is presented here in this slide is from CCMB. This is actually the work of an Alliance for Pathogenic Surveillance Innovations, APSI India, which was set up in July 2021 actually, And this was set up to strengthen India's public health surveillance capabilities. It's a pan-India initiative that is supported by the Rockefeller Foundation. And the data that's being generated is for 4 cities, Bangalore, Delhi NCR, Hyderabad, and Pune. So in the first phase of the work, the focus was on SARS-CoV-2 surveillance. So this was essentially to supplement India's clinical COVID testing and sequencing efforts. And then in the next phase, it moved into detection of SARS-CoV-2 and its variants in wastewater. And as you know, this is a very useful method by which one is able to detect emerging pathogens, and it serves wastewater surveillance can serve as an early indicator of disease outbreak. And that was demonstrated during COVID times. And now this entire surveillance network is positioned towards detection of resistant bacterial pathogens, and therefore the wastewater surveillance work has been pivoted towards AMR. In other community-based AMR surveillance work that is going on, this is data from IICT. Again, this is wastewater surveillance. The study analyzed 123 antibiotic resistance genes, ARGs, and 13 mobile genetic elements in wastewater from an urban community using real-time PCR. Sampling was conducted over a 5-month period between December 21 and April 22. And approximately 50% of the antimicrobial resistance gene subtypes were detected every month consistently with frequencies ranging from 52 to 61%. And during the winter, there was a notable prevalence of extended spectrum beta-lactamases, ESBL genes. Also worrying finding was the detection of NDM1, which is the resistance gene that confers resistance to carbapenems. Clinically important resistance genes and other variants, including resistance causing genes to 3rd and 4th generation beta-lactams, aminoglycosides, tetracyclines, and multi-drug classes were also detected. So this approach enables real-time insights, facilitates the early detection of emerging health threats, and it supports global health initiatives in order to enhance community health outcomes. I think these community-based surveillance systems and also wastewater surveillance systems serve the purpose of being able to supplement the surveillance data that comes from healthcare. From healthcare institutions. So I want to end by saying that CSIR is taking a multi-pronged approach to tackling AMR. The research is focused on discovery and development of antibacterial compounds, particularly against escape pathogens with novel mechanisms of action. We are also developing novel methods of delivering antibiotics and establishing methods for effective surveillance to generate data on AMR pathogen prevalence. Our future goals are to develop our promising leads as drugs, expand our surveillance work in collaboration with governments and other agencies. And our ultimate goal is to reduce resistance development, track new resistance mechanisms, and develop the tools to treat drug-resistant infections. And in all of this work, we see collaborations with those who have a common interest in AMR. Thank you.
Thank you, Radha, for that presentation and giving an overview on AMR and the work at CSIR. And as it was already projected by Srinivas, if you had any questions, you can get in touch with Rama Bansal or any suggestions, and that will be taken, that will come to us and we can actually take cognizance of it. With this, I thank both the speakers, Dr. Srinivas Reddy and Dr. Radha Rangarajan, for giving an overview on generic drugs as well as on AMR and CSIR efforts towards mitigating it. Thank you.
Thank you so much, Dr. Vinay, for this very insightful session. We now move on to our second session on food and agriculture. It will be chaired by Dr. Sridevi Annapurna Singh. Dr. Sridevi is Director of CSIR Central Food Technology Research Institute. She has a PhD in food science from University of Mysore. She has published well-cited papers in peer-reviewed journals, has several patents-backed technologies in the area of protein ingredients and foods that have been commercialized. Her contributions have been well acknowledged with several honors. With this, I hand over the floor to Dr. Sridevi.
Thank you, Dr. Rama, and a very good afternoon to all present. It is indeed a pleasure to chair this session of the CSIR event during the Science Summit at the 79th United Nations Assembly. CSIR for Connect, Collaborate, Converge, and Convert for Global Sustainable Development. In session 2, which is titled Food and Agriculture, we address 2 of the Sustainable Development Goals, that is SDG 1, No Poverty, and SDG 2, Zero Hunger. We all know that agriculture and food are basic, and there are nearly 8 billion people on earth to feed. So agriculture accounts for 4% of the global gross domestic product. And in some developing countries, it can account for up to 25% of the GDP. So agri-food and related industries are run into thousands of billions of dollars. And therefore, it is extremely important that even sustainability has to be taken into account when we talk of agriculture. Addressing food losses and waste is as critical to improving the food and nutrition security, as well as to help meet climate goals and reduce stress on the environment. Thus, reducing food losses can be achieved through food processing, and agriculture can also be sustainable by growing of value-added crops like medicinal, aromatic plants or flowers. Recognizing the need for affordable and sustainable agriculture and food technologies and generating wealth from waste, CSIR labs have been working on several aspects like improving agricultural yields, farm mechanization, optimization of unit operations in post-harvest food-based technologies, value addition to byproducts of agricultural and the food industry, novel methods of processing for retention of nutrients with improved digestibility and bioavailability, and sustainable agriculture for flowers and aromatic plants. Several of the CSIR labs, in fact, around 30 of them situated in different geographical locations with differing topography and climatic conditions, have been systematic based on fundamental science to make agriculture and food affordable, profitable, as well as provide livelihoods. They have been addressing several of the focus areas. It could be precision agriculture, post-harvest processing, maybe aroma mission, floriculture mission, all of which have been taken up as mission mode projects, pest controlling, better varieties of agricultural crops, agricultural machinery, or even and food technologies and drones. So in this particular session, which is titled Food and Agriculture, we have 3 speakers. And the first speaker would be Dr. Umesh Hebbar. And he is a BTech Chemical Engineering and PhD in Biotechnology with expertise in electromagnetic radiation-based processing of foods and process engineering and process scale-up. He has several research papers in peer-reviewed journals, book chapters, as well as 20 Indian patents and 6 international patents. He has been the principal investigator of several externally funded projects and is actively into research with PhD students. He has been awarded the UNU Kiran Fellowship to NFRI in Tsukuba, Japan, and has also won several awards from the institute. I would now request Dr. Umesh Hebbar to share his presentation. He would be speaking on affordable food technologies, and he will make his presentation now. Dr. Hebbar, please.
Thank you, ma'am. Thank you for the kind introduction. It's an honor to present the highlights of CSIR's contribution towards development of affordable food technologies for a sustainable future. With the increasing global population, the demand for food is also growing rapidly. As per an estimate, the food insecurity is affecting more than 3 billion people globally. with the shrinking arable land, rapid urbanization, and unpredictable climatic conditions, most of the future demands for food need to be met with efficient and economical agro-food processing technologies. Multi-pronged approach focusing on food preservation, value addition, waste valorization, effective supply chain management, etc., could only be the way forward for a sustainable future and for achieving the SDGs on no poverty and zero hunger. However, it is extremely important to synergize food processing with other critical components such as nutritional requirement, resource utilization, and environmental impact to bring in sustainability. CSIR in the last 8 decades made significant contribution in this direction, having affordability and sustainability as its inherent components of the technologies developed. CSIR focus is always been on developing simple technologies for preservation, value addition, to food as well as food waste, development of machineries, and innovative products. However, in innovative products, packaging solutions, adopting green technologies, besides looking at food safety and nutritional security for the health and well-being of consumers. I would be sharing an overview of technologies developed by CSIR in these areas. Technologies that are simple and adaptable at the rural level or farm level will have only low cost but also have good commercial potential. CSIR technology for preservation of fresh produces like fruits and vegetables is one such technology, and through simple intervention it can extend the shelf life of vegetables and fruits by 3 to 5 folds, which not only helps to preserve and process but also creates job opportunities. This technology has very good potential for application in other regions as well. CSIR has come out with more than 300 cost-effective technologies. Cost-effective technologies to convert fresh produce either into semi-finished product or finished product. This product range is very wide and includes beverages, concentrate, conserves, paste, jelly, etc., which have extremely good market. CSIR's CSIR has come out with more than 300 cost-effective technologies to convert fresh produces either into semi-finished product or finished products. This product range is very wide, and it includes beverages, concentrates, conserves, jelly, candy bars, etc., which have extremely good market. CSIR's focus in the value addition to underutilized commodities has not only popularized these foods but also helped to strengthen the rural economy. The shelf life extension. Something is moving. Removal of moisture from foods is one of the oldest preservation techniques. CSIR has developed a number of processes to dehydrate food commodities, especially the fruits and vegetables which are perishable, starting from the simple solar osmodehydration technique to novel 4th generation technique consisting of electromagnetic radiation assisted hybrid techniques and dehumidifier air-based low temperature drying processes have been developed with an objective to obtain good quality products at an affordable cost and with reduced impact on environment. Food machinery plays a very vital role in deciding the product quality and economic viability of the process. Right from its inception, CSIR is in the forefront of developing machineries and has come out with a number of impactful design know-hows for various operations. Machineries for cleaning, dehusking, milling of grains, including millets, energy-efficient roasters, bioplate casting machines, machineries for large-scale preparation of Indian traditional foods are some of the major contributions of CSIR. low cost but high efficiency approach has made these technologies affordable and sustainable. Fortification and enrichment of foods are the effective techniques to combat malnutrition, which is widespread. CSIR technologies have been developed to improve nutritional security across diverse population, including women and children. Technologies for fortification with minerals like iron, zinc, and calcium in ingredients and commonly used products such as wheat flour, bakery products, midday meal menu, fruit bars, candies, etc., have been successfully developed and commercialized. Technologies for cereal bar, energy drink enriched with protein, fiber, and minerals, fruit jam with fortified with vitamins and protein have provided an excellent opportunity to address the issue of malnutrition. CSIR is extensively working on adopting 3D printing technology to develop the products that are nutritionally superior and having good sensorial acceptance. Although long ago Hippocrates said, let food be the medicine, it appears to be more relevant now than ever before as inclination to look at the food as medicine has gone up significantly, particularly in the post-COVID era. Nutritious food could only hold the key to a revolutionary new healthcare system in future. CSIR has developed several products that fall in the category of sugar-free, gluten-free, low glycemic index, low-fat, pre and probiotic-rich, polyphenol-rich products. These products, which are in the form of beverages, bakery products, etc., have proven to support alleviation the diseases, including the lifestyle diseases. The change in the lifestyle and rapid urbanization is increasing and creating huge demand for convenience food and is expected to grow further. The challenges here is to develop these user-friendly foods which are not just tasty but also nutritious. CSIR's portfolio in this category has large number of products which includes instant mixes, pre-mixes, ready to eat and ready to cook products made from grains including wheat and millets, fruits and vegetable, plantation and meat and marine sources, and all have found very good consumer acceptability. Food waste management and valorization has become extremely important as it not only improves the process economy but also addresses environmental issues. Microbial degradation of complex molecules in coffee pulp, high quality dietary fiber from wheat bran and apple pomace, technology for utilization of agro waste such as husk, leaves, fiber, etc. as leather substitute that can be used in fashion, footwear and textile industries are some of the major technologies readily available for commercialization. At the base level, packaging provides protection for the product that is inside. At the same time, it also plays a vital role in maintaining product quality and influencing the consumer acceptability. Use of biodegradable packages and tableware have become essential now as conventional polymeric packaging are creating environmental pollution. CSIR has foreseen this long ago and initiated work in this direction of providing affordable and sustainable solutions. Technologies for using agro residues like areca sheath, rice bran and husk, banana stem, pineapple leaf, millet waste, etc. to make cutlery have been developed. CSIR is also working on intelligent and active packaging solutions to enhance food quality and safety, efficacy and convenience. Safe food is essential to human health and well-being globally. Adulteration and microbial contamination are the two major concerns. Detection of adulterants is essential to ensure food safety, and the need of the hour is to have detection methods, kits that are rapid and simple to operate. Immuno.ELISA kit for aflatoxin, Ksheer Scanalyzer for milk, NIR-based oil analyzer, as well as honey adulteration detection system are some of the major contributions of CSIR in this segment. Creation of human resources that is globally competitive is paramount for sustainability. CSIR is actively involved in training and skill development in different domains of food science and technology. Short period but intensive trainings, skill development programs, aligning with national missions and international training programs in specific areas are the major activities through which more than 25,000 participants have been trained so far, and we continue to do so in future. I conclude my presentation saying that CSIR envisages a vision of developing sustainable solutions in all fields of science and technology, including agri-food sector, and we are happy to have collaboration with all stakeholders. Thank you.
Thank you, Dr. Hebbar, for giving an overview of all the technologies that are having relevance in the area of food and agriculture from CSIR. And in fact, CSIR has played a very big role in the growth of the food industry in India, which is poised to attain around $535 billion US by 2025. Our next speaker is Ms. Ranjita Pradeep, who is a startup and has been associated with one of the CSIR labs as a technology partner. She is the founder of Ayurveda Coffee, a company that is dedicated to promoting health and longevity. She has a master's degree in business and marketing from the American Heritage University of Southern California. And having worked in various regions and cultures, she has gained valuable insights. And through her company, she would like to use natural products from farmer communities to guide young entrepreneurs from both rural and urban areas to pursue their dreams and passions. I would now like to invite Mrs. Ranjita to please talk about her association with CSIR as a technical partner and her business. Over to you.
Good evening. Good evening, everyone. Dignitaries present at 79 UN Summit. Am I audible, please?
Yes, please go ahead.
Yeah. I'm Mrs. Ranjita Pradeep, representing Ayurveda Refresco Coffee. I take this opportunity to share my entrepreneurial journey and experience in the coffee industry. Ayurveda Refresco Coffee, a journey of innovation. Ayurveda Refresco Coffee has embarked on a 5-year exploration into coffee culture, understanding diverse community preferences and lifestyle to create an innovative product that blends tradition with modernity. Our main goal is to promote health and longevity through our unique coffee offerings. The role of food technology. Food technology is rapidly evolving, driven by innovation that enhances food safety, sustainability, and nutritional value. Ayurveda Coffee stands out by offering a unique approach that combines coffee with ancient Ayurvedic herbs, spice, dry fruits, and nuts. Our coffee cubes are packed with natural nutritional values and infused with essence of nature. The key benefits of Ayurveda coffee promotes health and longevity, convenient and versatile, natural sugar, high nutritional value, and backed by science. And the next, I would like to thank CSIR CFTRI, collaboration with CSIR CFTRI. Our partnership with CSIR CFTRI has been crucial in advancing food technology in India. They have provided significant support through research and development, helping us innovate and improve our product offerings. This collaboration has facilitated the adoption of new technology that enhanced food preservation, processing efficiency, and nutritional quality. Contribution of CSI CFTRI. Research and development, conducting extensive research, creating a new product, collaborating with our startups was a wonderful experience. Technology transfer, assisting us a startup in adopting advanced technology. Training and capacity building. So extensive training programs were given for our startups and made us to develop an innovative product with a collaboration. CSIR CFTRI has significantly supported Ayurveda Refresco Coffee by providing a platform to showcase our innovative product at 32nd International Conference of Agri-Economists in Delhi. We even launched the product in a collaboration at CFTRI. It was a great opportunity for us. So looking towards the projected revenue, we aim to achieve a 3x turnover growth in the coming years. Ayurveda Refresco Coffee is looking for an upcoming turnover of 30 to 50 lakhs for FY 24-25 and 1.5 CR for 25-26, FY 25-26 and 2.5 CR FY 26-27. Next comes sustainable approach. Ayurveda Coffee is committed to sustainability through using organic and fair trade coffee, produce zero waste with our coffee cubes, capsules, bubbles, reusing and recycling the coffee ground, for example, like a garden fertilizer, and buy the coffee beans in a bigger bags to minimize the waste and create a conscious mind from cradle to grave. Special recognition. I extend my heartfelt thanks to CSIR CFTRI to their key role in developing Ayurveda Refresco Instant Coffee Cubes technology. Your expertise in blending convenience and quality is greatly appreciated. We look forward to future collaboration. I would specially thank Director of CSIR CFTRI Mysore, Senior Principal Scientist TTBD Head CSIR CFTRI Mysore, Senior Principal Scientist and HOD Department of Spice and Coffee, CSIR CFTRI Mysore. Thank you for your attention. I look forward to engage in discussion on how we can further leverage the technology in the food sector for a healthier future. Thank you.
Thank you, Ms. Ranjita, for taking us through your journey and partnering with CSIR to bring forth healthy products and also sustainable farming and improving lifestyles of both farmers and youngsters. Thank you for presenting the industry perspective.
Thank you, ma'am. Thank you for the opportunity.
Speaker today is Dr. Ajit Shastni, Director of NBRI, that is the National Botanical Research Institute, Lucknow. Dr. Shastni has PhD in molecular biology and biotechnology. He was also serving as the former director of ICAR, National Institute for Plant Biotechnology, New Delhi, and was the former chief scientist of the biotechnology division in CMAP, Lucknow. His interests include plant diversity, metabolic engineering in medicinal and aromatic plants, and bioprospection for human health. He has over 140 publications and about 101 patents. He has guided several PhD students as well as MSc students, and he has been receiving several recognitions and awards, including being elected Fellow of the National Academy of Sciences, India, Allahabad, and Fellow of the National Academy of Agricultural Sciences, New Delhi, CSIR Technology Prize for Biological Sciences and Technology, and CSIR Technology Award, CSIR Young Scientist Award in Biological Sciences, as well as many more. Today, he would be talking about sustainable agriculture, especially the success stories of the mission mode projects of CSIR, including floriculture and aroma mission. Over to you, Dr. Shastni.
I hope my slides are visible.
Yes, very much visible.
Yeah. Thank you for giving me the opportunity. This is the success stories of mission floriculture and aroma. So I will not talk about the sustainable agriculture as such, because everybody know what sustainable agriculture is. And believe me, in CSIR, all the mission projects related to agriculture, they are fulfilling around 7 to 10 SDG goals. So having said so, these are the floricultural missions: Aroma mission, Millet mission, empowering farmer through food and technologies, Cotton mission, precision agriculture, genome editing, organic waste and composting, improved Samba Masuri. And these are specific projects. And floriculture and aroma missions, these are the large scale projects which are being taken up by CSIR. And believe me also that we have worked on this project and working in this project by recognizing the difficulty of the farmer and what they want, how they can be empowered. And these are the project, and coming directly to the floriculture scenario in the global as well as India. Actually, India ranks around 14th in the world for exporting floricultural goods, and it accounts around 0.6 of the global flower trade. That is because all the productions of floricultural crops are being consumed inside India. India is a big market of floriculture also. So like this, export in floriculture is increasing year after year, as well as the import of floriculture is increasing year after year. So we have in India a large market of floriculture, which we are trying to cater, vis-a-vis empowering the farmer to grow and improve their livelihood. So in the floricultural mission, we have different verticals. What we do actually, we have vertical A, production of the quality planting material, because we know that for good horticulture or floriculture need good planting material. Then expansion of area under floriculture, we expand the area. And here what we do, we don't go for replacing the conventional crops. We go for the barren lands, we go for the underutilized land, degraded land, where we advise the farmers to grow these crops. Urban floriculture, vertical farming, and rooftop farming, we give training as well as we encourage people in the urban area to grow floricultural crops, which can also be marketed. The post-harvest and value addition technologies from the floriculture and the aroma crops, how we go for the, I will be talking about this, how we go for the value additions. Then integration of apiculture with floriculture. So when flowers are there, then honeybees should be there. So we introduce and integrate the apiculture, and this apiculture also increases the yield. Without honeybee, the yield will be very less. Effective market linkage. We help the farmer to go for how they can be linked to the market. We help in that way also. New variety development, that's the integral part of this mission. So we have around 7 labs working on this. As Madam Sridevi told, 30 labs are involved in CSIR in these projects, directly or indirectly. And here it is 7 labs which are working in this project directly. So to tell in details, the number of districts, we have 244 in India, we have covered. Aspirational district 14, expansion of area under floriculture, that is around 2,280 hectares of land. And there are several number of beneficiaries. There are beneficiaries in apiculture, the floriculture gardens, urban gardens we have developed, all through CSIR, vertical gardens are being developed. And there are awareness skill development programs are being organized all over India. And it has been organized right now also. Then there are a number of entrepreneurs that are being developed in this particular mission project. And coming to the economics, we not only go for helping the farmers, giving the planting material, area expansion, we also try to calculate the economics and how much money they will get from different parts of the country, depending upon the demography, depending upon the soil type, depending upon the flowers they grow, and depending upon the climate that is occurring in that particular area. That is an integral part of this mission. When I say integration of apiculture, we have developed a calendar in which month, which flowers will be needed for honeybee to collect the pollen as well as the nectar, so that all around the year, the floriculture as well as honeybee cultivation, honeybee integration will be going on. Then there are many entrepreneurs specifically in honeybee are being also developed, and we are developing the entrepreneurs. And if I give one example, in coconut, after our intervention with apiculture, the number of troops are being increased. In areca nuts, the number of nodes were increased, as well as in mung bean, that's the 3 sample crop we have taken, which has the yield has been increased. And the picture shows in a tribal district how happy the farmers are getting their first product. And about the value additions, we have different products. All the labs, they are working on different products like perfumes, absolute, concrete from the petals, fragrance petals. And we have fibers produced from different plants like lotus tea, which is health rejuvenating, lavender honey, handmade dhoop, cones, marigold wax, freshness keeper papers, herbal and textile colors, and different colors from the flowers, which can be used for different way, maybe sometimes for the food colors. Also, we are giving emphasis on the Indian floriculture crop. The indigenous plants are being domesticated by different labs to bring to the mainstream. In addition to the normal crops which are being grown all over India, and the crops which are exotic plants which are used for cut flowers, along with that, we grow for the Indian indigenous plants, domestication. So this is one of the snapshot from one lotus plant, how we have commercialized all the produced all the products like lotus tea, lotus fiber, jacket making, lotus perfume, lotus-based perfume, and it has been asked in one of the biggest quiz program of India. This particular question has been asked about the lotus. The success stories, the India's first organic lavender honey. So we go for crop-specific honey, supported by DNA fingerprinting of the pollens, supported by microscopic analysis, and all the analysis that we can undertake. So we can prove that honey is from specific crop, which is having different medicinal property. Then making India self-reliant in tulip. So large scale, like one of our lab, IHBT, is working on tulip plant cultivation and domestication. Now lots of money they get from tourism also. In addition to that, the flowers are being sent to different temples. In CSIR NBRI, Kalyani, that is a self-help group of women. So we give training in dry floral craft. And dry floral craft, by this, the women, they can make different crafts from the petals and the leaves and the seeds of different flowering plants, and they can sell them to get their income increased. I'll just give an example of temple flowers. The temple, there are, if you calculate in India, there are more than 2,000 to 3,000 medium temples, medium scale temples in terms of flower utilization, and around 200 to 300 big temples, where around 2 ton to 5 tons flowers are being required daily. So these flowers, we thought of working around the temple by making clusters around the temple with different flowers, which are required for the temples. And from the flowers, we are trying to develop now the entrepreneurs by which they can sort the flowers to different colors, and the colors can be extracted, from which a gulal that is used in the holy festival of India, a biggest festival of India. So this can be made. Liquid sindoor, means the sindoor which can be put as the symbol on the forehead. Then textile dyes can be made, and essential oil can be extracted from the used flowers. From there, concrete can be done. Absolute can be prepared. Perfumes can be prepared. Incense stick can be prepared. So all the flowers can be utilized in that way. In other way, dry floral craft can also give money to the women for women empowerment by making ash. So we have the belief of we can make a sacred ash, and this can be also fetching some amount of money to the farmers. In addition to that, the flowers which are being left, they can be used as carrier of biofertilizers, different bacteria, and the leftover can be taken for the vermicomposting, and those can be sold. So sustainably we can create a micro economy around the temple, and we are targeting also some of these are all technologies are available with all the CSR labs which are involved. So this can be targeted in future to develop microeconomy, and we have developed some technology, transfer some technology to different farmers to develop the microeconomy around the temple. So we have calculated the economics also. So how in a temple, how many man-days can be employment can be generated, as well as how much product can be sold in that particular area. I said the frugal approach of the temple economy and micro generation of the microeconomy. Coming to the CSR mission quickly. So this is also the self-sustaining aroma missions. We know that we are earlier importing aromatic oil. Now we are exporting the aromatic oil to different countries. So we are having the cultivation, distillation, value addition, and aromatic production of different aromatic products. So these are the different clusters. So we are around 33,000 hectares of land covered till now. Then manpower deployment improved and efficient distillation unit for extraction of the essential oil around 300, more than 300. And there are different type of success stories like purple revolution in Jammu and Kashmir in lavender, largest exporter of lemongrass oil in the world. Then golden revolution in Himachal, enhanced rural economy to drought-prone area in Bundelkhand region, aroma cluster in tribal areas, new varieties developed 33, entrepreneurship developed 110, then sustainable aroma culture also developed in that way. So we are working specifically giving emphasis on the tribal area and for the upliftment of the tribal people. So this map shows where in India we are working on the tribal population. So there are some success stories like barren lands producing liquid gold from the farmer of Himachal Pradesh, then CSIR aroma mission in northeastern region. So integrating the northeastern region and going to the tribal and working with them. And CSIR CIMAP also set up the India's first sustainable aroma culture near Lucknow, which high-tech cultivation. Then Purple Revolution, Jammu, as I told you already that CSIR IIM aroma mission, that Purple Revolution, this was the point of attraction in the Republic Day last year. Then Samadhan Kendra, then integrated internet-based user-friendly software to benefit rural population. Then Kisan Seva, it is also app and portal launched in 2020 to connect farmers and the stakeholder. So with this, let me tell you that we work for the social sector and the cultural sector for developing microeconomy to bring the tribal farmers as well as other farmers and upliftment the other farmers in the mainstream with different technology available in our hand. We try to develop startups as well as the entrepreneurs, and it's integrated technology by CSIR, which is done efficiently, and we will be happy to have collaboration in future if it is required. Thank you very much. Thank you for giving me the chance.
Thank you, Dr. Shasni, for a wonderful overview of all the success stories that these two aroma and floriculture mission have brought about. And you have touched the lives of both farmers as well as rural people and women in not only creating technologies and value addition, but also ways to wealth. So thank you very much. With this presentation, we have now come to the end of this session on food and agriculture. I think this is the one theme that touches many lives. As Dr. Shasni said, it is socially relevant, but it is also capable of becoming a very good economic spinner. And not only students, but farmers and women and rural entrepreneurs, the small scale entrepreneurs, as well as multinationals, all of them have a role to play when it comes to food and agriculture, even as the environment has to be taken care. Therefore, although we say that we were addressing SDG 1 and 2, probably all the sustainable development goals would become relevant when we talk about food and agriculture. Having said this, I think all the three speakers have done a marvelous job of highlighting all the capabilities of CSIR, and we hope that we will be able to collaborate with whoever would be interested. And we have nearly 30 labs which are working on various aspects of food and agriculture, and we would be able to hold hands with any future collaborations. With this, I thank all the speakers for their very, very insightful talks, and I hand over to Dr. Rama Bansal. Over to you, Dr. Bansal.
Thank you very much, Dr. Sridevi, for this very insightful session. We now move on to our third topical session, which is on environment and waste management. It will be chaired by Dr. Harinder Singh Bisht, who is Director of CSIR, Indian Institute of Petroleum. Dr. Bisht is a PhD in polymer science from Garhwal University. He was a postdoc fellow at Wayne State University, Detroit, USA, and Bourgogne University, France. He has diverse experience of working in research and academic institutions as also in the industry. Dr. Bisht has filed 11 patents and published 21 research papers in peer-reviewed journals. With this, I hand over the floor to Dr. Harinder Singh Bisht. Over to you.
Thank you, Dr. Rama. Good morning, good afternoon, and good evening to all the organizers and all the participants of Science Summit at 79th United Nations General Assembly 2024. Welcome to session 3, which is Environment and Waste Management. And this session is devoted to United Nations SDG 7, that is Affordable and Clean Energy. SDG 12, that is Responsible Consumption and Production. And SDG 15, that is Life on Land. As we are aware, the major challenge facing us today is cope up with the climate change and global warming, which is predominantly caused by human activities, and its effect is visible on the life on land. And to minimize these effects, a lot of emphasis is being given toward reducing use of fossil energy and valorization of carbon neutral feedstocks such as agro and bio waste for sustainable fuels, chemicals, and materials. And in this direction, CSIR is working on conversion of various waste materials generated from natural resources like municipal waste, food waste, agro waste, animal waste, etc., into useful products such as sustainable fuels, methanol, sustainable materials like vegan leather, and other many more such kind of initiatives CSIR is taking on this area. Another major challenge facing us today is availability of clean water, which is essential to maintain the terrestrial ecosystem. CSIR is working on domestic as well as industrial wastewater treatments and management. The efforts of CSIR on waste valorization will be presented by Dr. Ananda Ramakrishnan, Director, CSIR, National Institute of Interdisciplinary Science and Technology, Thiruvananthapuram. Dr. Ananda Ramakrishnan is, Dr. Ananda, can you please come switch on your video also? Yeah, so Dr. Ananda Ramakrishnan is very renowned scientist in the area of food and agro processing. His vast experience lies in nutrient delivery systems, 3D food printing, and modeling of food processing operations. One of his key research breakthroughs is development of engineered human stomach and small intestinal model systems. The efforts of CSIR in the area of wastewater treatment will be covered by Dr. Girish Pofali, Chief Scientist, CSIR, National Environmental Engineering Research Institute, Nagpur. Dr. Girish, can you also switch on your video, please? Dr. Girish is a PhD in environmental engineering. He has 28 years of experience in water and wastewater treatment systems and provided solutions to all type of industrial wastewater, including textile, tanneries, chemicals, pharmaceuticals, distilleries, dairies, slaughterhouses, SS rolling mills, etc. And he has developed natural treatment system for domestic sewage treatment. Now I invite Dr. Ananda Ramakrishnan for his talk on waste to wealth, from research to real world impact. Over to you, Dr. Ananda.
Thank you, sir. I hope my slides are visible.
Yes, sir.
Yes.
Yeah, just I'm going to talk about waste to wealth from the research to the real world impact. If you look at any industry, a huge amount of the waste is generated, either agro or food and bio. Any processing industry waste is almost is generated 1/3. But how we are going to use that for the good or the benefited for the circular economy or the wealth. In this talk, I'm going to cover 4 aspects on the waste to wealth. And one is the agri-bio waste, the bioenergy, chemical and materials, and other value-added product. First, if you look at the labs, more than 10 labs in CSIR system is working on waste to wealth, from the NIST, IICT, CBRI, NML, IIP, IMT, IMTAC, and SIMFA. First one is the agri-bio waste. If you look at agri-bio waste, one is such as that biomedical waste generation. Per day in India, 700 tons of the biomedical waste is generated. Right now, the system is to take this biomedical waste, including the body parts, blood, all these things taken onto the incinerators. And there it's incinerated. That's the way regulation stays. But United Nations recently told that reduce the incinerators, and some of the country already decided to reduce the incinerators, for example, Philippines and other country. But what is the solution for alternatives? Some of the technologies are developed like a microwave and other digestion technologies, but still not at the level of incinerators what it does the job. So CSIR NIST has come up with the two-stage technology. One is the disinfection and solidification. This is the purely chemical-based method when you collected the biomedical waste in the operation theater, where the waste is generated, that place itself, you can keep it this equipment and you dump all the waste, except you need to segregate the plastics and needles. Then this solution will be added. The solution is developed by the CSIR NIST, will be added at the particular level. Then every kg or every gram, it will be added according to that chemical, and per kg per minute it will be solidification takes place. The disinfection, second stage is the solidification. Then you will get it in the soil additive, what it has shown in the figure. This soil additive can be used for growth of the plant. It is not going to be a waste, because all this material, what is the biomedical waste, so called, as the good amount of the minerals and other nutrients. So that we wanted to use it for the soil additives. And even we tested this material to the how the plant growth and the yield. If you look at when we put the virgin soil and vermicomposite, and the treated biomedical waste gives 3 times higher than the virgin soil, or the 2 times in the close to the that vermicomposite side, especially for the yield in terms of the total brinjal yield. So definitely this is the another technology can be used in the hospital itself. That can be save a lot of money on the transport, more than anything else, the carbon footprint. For example, in one city of Trivandrum, this biomedical waste has to transport it to the Palakkad, where the incinerator is happening, almost close to 500 kilometers. So similar scenario for throughout the country, throughout the globe. So this technology, as so-called, is termed as a CSIR game-changing technology. We are very soon going to set up this same technology in the AIIMS New Delhi to see that how it works in the real hospital environment. Once this will be validated, we wanted to expand throughout the globe. This technology wanted to use it, and can be used in the existing incinerator space itself, can be set up this same technology. That's the idea. Another one, waste to wealth technology developed by CSIR NIST, is the biodegradable cutleries. Can be come from the wheat bran or rice bran, rice husk, sugar cane waste, all these things, different plates, cups, everything has been developed by us. We preferred and we suggested to use only single use, but we can use it the multiple time. And once it is used, can be used for the cattle feed. That is the beauty of what the technology developed by us. And it can be a very clearly circular economy. And we transfer this technology for more than 14 companies. We made the machine for total automation of these cutleries. If even recently set up the one plant is produced 3 tons per day. So this now our entrepreneurs have started exporting into the other countries. This is the ideal choice of using the whatever comes from the agro waste generated in the various places, the various industries. Apart from that, another one, we developed the plant-based leather alternative or leather substitutes. We know that either banana, pineapple, or rice, or the cactus has a lot of fibers. We try to extract the cellulose fibers and we convert it into the leather-like structure. So you can call it as a vegan leather in the commercial terminology. Can be replaces by the 50% of the synthetic leather chemical. It's a low carbon footprint and it's a low cost compared to the animal or even synthetic leather, because of chemical usage is 50% less and the cost of the production also less. We totally optimize this process, and recently our product has been tested by the international agency, certified that more than 90% of this material is plant-based material. That's what our entrepreneurs started thinking to export into the various countries. Already we licensed 6 companies. This can be not only solve the problem of using excessive amount of chemical in the leather industry, also increase the value for the farmers or the entrepreneurs. For example, the waste, banana industry waste is almost 28 to 40% waste. Can be utilized something else. This is the ideal option to do that. The cactus, it is the rainford area, it will be easily grown, can be used to convert as the leather-like structure what we created in our institute. This is another area, can be expanded even into the automobile industry, can be seat cover, all the things can be utilized from this plant-based leather. And apart from our institute, AMRI Bhopal has done some other work based on the stable burning that has been taken and molded on the sheet-like structure. This can be easily madeable and it's a very good compared to the other boards or whatever comes the pressure board equivalent to that particle boards. This board can be used anywhere else and can be reduced the control of air pollution and is a very healthy alternative to existing the wood boards whatever is available. Other institutions like IMT and NPL and CBR has done different agro waste into the biochar, biocoal or biochar clay plasters. All this material has been developed from the waste generated from the agriculture waste.